to identify your patient. So I would come in, I would tell the patient who I am. Hi, I'm Jennifer Anderson. I'm a nurse at the USA College of Nursing, and I'm going to be performing a dressing change on you today. You will have a record, a patient record just like this every time you do a checkoff. If you open it up, it has doctor's orders. And if I look on here, let's see which number it is. We have number 7, normal saline, wet to dry dressing change to abdomen every 4 hours. So I have just checked my doctor's order. Now I need to verify that my patient is who they are supposed to be. This is supposed to be Jaguar J. Jones. So I need to come over here and I need to look at my armband, which says right patient. So just assume that that says Jaguar J. Jones. And I need to check another identifier. And I do have a medical record number here, so I can check that as well. You can also, which I like to always also ask the patient if they can tell me their name. Don't ever say, are you Jaguar Jones? Because if they're demented, yep, that's exactly who I am. Ask them if they're John Wayne. Yep, sure am. So always ask them, because in the event that someone accidentally gets a wrong armband, which hardly ever happens, but still we need to check. Now, we also right here have an allergy band. And if we look on here, we have aspirin, ASA. And right here it says the patient's allergic to aspirin. And you can always ask them again, are you allergic to anything? All these checks and balances make sure that we catch any errors. So that's the very first thing that you need to do, is do all your checks. Now I need to get ready to do my dressing change. So the things that I need to do is I need to raise my bed to a comfortable working height. And now that I'm not plugged in, I can't do that. So pretend I'm raising the bed, because this would be too low for me. And then I do need to lower my side rail to make for easy access. I do need to position my trash can wherever I would like to have it. And I need to wash my hands. Okay? I then will need to expose the wound. But remember, when you expose the wound, that you only expose what you're working with. This patient's got an abdominal wound. There is no reason her breasts need to be exposed. We're not even going to be there. But also, don't get so focused that you're giving yourself such a small space that you contaminate. You have to have enough area to work as well. So I'm going to turn down the covers, and I'm going to expose the wound. And I want to keep their private areas covered. Think about this of yourself. You wouldn't want to be open for everybody to see. And so then there's my wound. Okay, so the next thing I'm going to need to do is apply my clean gloves. And now I'm going to remove the patient's dressing. You are supposed to take the tape and you're supposed to come towards the center. So ease the tape off. This comes off very easy because there's been a lot of practicing. And then I'm going to take it and I am going to turn it away from the patient, because I don't want to fan what's in there in the patient's face. They don't want to see that. But do I want to see it? So I'm going to come over here, I'm going to look at it, and I'm going to see what kind of drainage it is. Maybe we have a little serosanguinous drainage. Maybe it's a little bit of yellow drainage. If it's purulent with green and yellow and it's a bad odor, those are important things to know. We need to be charting them. So you want to look at that. And then I'm going to take the dressing. I am going to ball it up in my hand. The correct way to take these gloves off, because I was touching a wound, glove to glove, skin to skin. Which, if I can get my finger in there, and drop it in the trash can. Okay? The next thing I'm going to do is I'm going to assess the wound. I'm going to look at the wound, look at the appearance. Does it look like the edges are well approximated? Is it beefy red? So assess your wound, see what's there, because these are things you need to document. Okay? So the next thing I need to do is I'm going to get ready to do my sterile field. These saline bottles all have expiration dates on them. We always want to make sure that they are they're not expired. This one says June of 2012. Yes, that's expired, but let me go ahead and tell you guys something. We get the supplies that are expired here. Okay. So, in the real world of nursing, if you saw this bottle in practice, we would not use it because it's expired, but everything you guys are going to pick up is probably going to be expired. So now, I have checked to make sure that this is indeed not expired. I'm going to open up my sterile package. Let's see how these open. Are they perforated or do we pull them?
So between removing the dirty dressing and applying the sterile fluid, you wouldn't perform hand hygiene?
Just at one time. Go by your checkoff verbatim. This right here is what we use to check you off. So if you were following this for every item, there is no way you can go wrong. And it only says at number after you position the trash can, perform hand hygiene. Now it did say to raise the bed afterwards and lower side rails. If you do them differently, it's not as much going to matter. And to be honest, after I touch the bed anyways, I still like to wash my hands. And another thing to think about is too, that you really can't leave the bed after you you put the side rail down. So if it's something that's easy access that you can just reach over and do the antiseptic hand wash, I never want to walk away from my bed like this. But try to go as much by this as you can, but you only wash your hands that one time and then when you exit the room. Okay?
Do we read to you, Jennifer?
No, I'm
You
fine.
sure? Okay.
Okay, so now we are going to remove this. Let me talk to you guys real quick about a couple things. This right here. This bag is included. I strongly suggest you not use this bag. I'm going to show you what you can do with it, but I'm also going to tell you what happens. What we could do with this bag is set it right over here and use it to put dirty supplies in. But I'm going to tell you what every student that usually uses this does is because they don't want to put their dirty stuff on the patient, they reach in there. So if it were me, I would not use that bag. I'm not going to tell you you can't because you can, but I'm going to tell you that this usually causes a student to fail. So if it were me, I would not use this. I would use this trash can right here. Okay, so this stuff right here, I'm going to put it to the side because it belongs to somebody else. And then this is your sterile field. I'm going to show you guys how to open up a sterile field. There is a way to open it. What you need to do is you will open the first flap away from you. You guys, the hardest thing you're going to have to do is figure out how to get everything on this table. I promise.
Right.
Make it easy for yourself. See how I move this stuff down? When you open it up, move that stuff. Now, what I'll probably do, because my patient's over here, is I'm probably going to change this up a hair. I'm going to put it over here, because now I'm working easier with the patient. So, first thing I'm going to do is I'm going to open my first flap out. Sometimes they'll stay, sometimes they won't. Okay, so that's my first flap. The next ones go out like this. So I'm going to grab this one, I'm going to pull it out. Now this right in here is clean. This right here goes against the table, so you're okay to touch that. But remember, there is a 1-inch border all the way around here, and that is the maximum you can touch, 1 inch. Now the next thing I'm going to do is I'm going to turn this one. The very last thing I'm going to do is pull towards me. I personally would not use these either. So it's up to you what you do, but I would take them out. Okay, you see how my kit is right now. It's kind of at an angle. Now I can touch right here, that is within my 1-inch border. What I want to do is I want to turn my sterile field like so, because now I've given myself more room on the other side of the table. Remember, 1-inch border all the way around. The other thing I want you guys to know is what's hanging off the table is not sterile. So whatever's on the table creates you new 1-inch border. So technically, here is my table. So really, to be honest, my 1-inch border is right along in there. Okay. Try to work in the middle, because just try not to get too close. Just keep your stuff centered, that way you don't get near it. Now, I cannot do this and grab anything because I cannot see it. Okay? So, the next thing I'm going to do now is I'm going to open my bottle of saline. Now, I want you guys to know something. This right here is also sterile. It always needs to be sitting up. You can't do that. The reason why is we do recap these bottles and reuse them later. Every hospital is different once you open them. It can be 48 hours. I think is the usual rule of thumb. I don't think there's anything over 2 days, but you must write your name and your initials from when you opened it. If you forget and do this, just know that you've got to now throw this bottle away when you're finished. Okay? So what I would do is set this right here and that right there, because I have got to be able to get easy access to this bottle. Now, I am going to put on one sterile glove, and I got some water here. Please know, you guys, water, if you get water on a sterile field, it is contaminated. So I'm going to come over here. Now I can move around. I still can see my sterile field. I can still see my patient. Now when you open these, I'm going to do this kind of quickly. Miss Norris just did it, but you can watch me do it again. You guys see how I'm touching these edges? We don't want this to flop back over, because if it does, it contaminates our glove. I have now got, and really technically, you guys see my package went over that right there? I've contaminated it. So my bottle now needs to be thrown away. Is that going to fail you? You just tell me that it went over there, I've now got to throw it away. So I do know I need to throw my bottle away. We have 2 sterile fields. This is a sterile field, that is a sterile field. This sterile field still's got 1-inch borders too, guys. So now we're going to glove one hand. So I'm going to pick up my glove, and I'm going to glove my one hand. You guys, watch your fingers. You guys will put on your gloves and not realize it, and you're like this, and you're all over here, and then before you know it, you've touched. Keep it down towards the center or pick it up. Now, if you pick it up, also remember, these fingers will sometimes flop over, so my suggestion is to get used to kind of pointing it down like that till you get them on, and then you can put them up, okay? So I have my one sterile glove. Now what I need to do is I need to set up my sterile fields. This right here, you guys, is full of all kinds of stuff. I don't think there's anything you need in there. So if it were me too, I would take that out. My advice to you guys is don't keep things you don't need so you don't have to mess with them. The other thing you don't need is this right here. So if I were you, I would take it out. Now, you can move this stuff around however you like. I call this the meat tray because it looks like a meat tray. You have 4x4s in here, you have tape, and you have an ABD pad. The tape does sometimes want to stick. Okay, remember my 1-inch borders, I'm keeping everything kind of centered. You need to take the ABD pad out and just kind of find you an area to sit it. Now I know I'm having to reach over some because I have to work. We cannot do this. This is an unsterile hand and now I've just broke. But you can kind of work around like so. Now you need to put 4x4s into your tray. You need to keep at least 2 out. We will give you guys extra 4x4s because really these 4 are really not enough. Okay, so now I'm ready to pour my saline. So now I'm going to come, remember 2 sterile fields, I got to come dead center in here, but now I got to keep my hand right here too. It can't drop below my waist and it can't go out of my vision. I grab the sterile saline. You're supposed to cover the label with your hand so that if any water was to run on your label, it would not erase any writing. So now I'm going to come over here, and I am not going to pour in this particular because I borrowed this tray and I don't want to wet her tray, but you would come over here and you would pour saline into the tray. You guys do not put tons of saline because if it splashes and you get water out here, you've contaminated your sterile field. Also, you can't get too low because look at that bottle, you'll end up touching as well. You have to get it close enough that it doesn't splatter and also far enough away you don't touch. How are you going to do that? You are going to practice and practice and practice. So we are going to lightly wet our 4x4s and then we're going to come back over here. We're going to put our saline back down and now I'm ready to put my other glove on. What did I just do? Did you guys see?
Yes.
I contaminated. So what would I say?
Contaminated
Okay.
and get new gloves.
That's correct. So if you do that in the real setting, you say, I have contaminated, and I'm going to look at you and I'm going to say, what are you going to do now? And you're going to say, I need to get myself another pair of sterile gloves. Okay, so what would have been the right way for me to put on that glove?
Put your fingers on the cup.
You scoop. Okay, and watch your thumb when you put it on because it wants to get in the way.
So wouldn't you have to start all the way over?
It depends.
Because you would have to get new gloves.
Sometimes they'll say, I'll get you another pair of gloves. Sometimes they'll say, well, let's just keep on going. The important thing is you don't think, did she see me? Did she see me? And just keep going and think that we didn't see you. Stop and say, I contaminate. Now I'm going to say, okay, what do you want to do about it? You guys are allowed one contamination and still allowed to pass. But if you contaminate and don't tell me, then you do not pass. Okay, so now, see, I'm just kind of keeping them in front of me so I can watch them away, interlocked. Now what I'm ready to do is I'm going to clean my wound, okay? So what you're going to have to do is you have to pick them up, you have to lightly squeeze them out. Keep them over your tray because, again, water on your sterile field is going to contaminate it. So what I'm going to do is I'm going to clean the wound, okay? Now, this one is not wide open. In other words, it's not huge like those decubitus we were showing you guys. So what I would probably do with this one is I would start in the center and wipe out and then throw it away and get me another one. Now, since I only have two, I'm going to use this one again, but let's pretend it's a new one. I just got it on my tray. And then I'm going to go from here and go out and throw it away. You have to clean a wound per what it actually is. If this was a big round wound, in other words, it was open, I would clean a little bit differently. I would end up starting in the center, clean like this, throw it away, the center like that, and throw it away. But I would stay inside the wound because it was open. And then I would come later and clean around the edge, throw it away, get another one, edge, throw it away. Never bringing from the outside into the inside. But this little wound right there is not open, so I'm able to clean like so, throw it away, and then like so and throw it away. Does that make sense? But if we give you a big round one, you're going to have to do it a little bit different. I think this is pretty much what you're going to see. Okay. Now, there is a suture line. Do you remember what Miss Nora said up there about cleaning the suture lines? You are going to have to do both of them. You are going to dress this one, but you are going to tell us how to clean that one. So the correct way to clean the suture line would be, and again, I'm going to keep pretending like I'm getting a new 4x4, is what I would do. Now, if you're good, you can take and turn it and use different edges, but that takes a little bit of practice. So what you would do is you would actually start in the center of the suture line, and you would wipe out, throw it away, and get another one. Then I'm going to go out from here, throw it away, get another one. Start at the center, work my way out the first staple, throw it away, get another. Same thing, you're always going from the center, you never cross the center. So this would be 1, 2, 3, 4, 5, 6, 7. I've got 7 staples, which means 14 swipes from center out on both sides. That's a lot of swiping, but that is what you would have to do. Does everybody understand that and understand that diagram on the board? And you have it in your book. Okay? So now, I have cleaned the wound. Now what I'm going to do is I am going to throw that away, but I'm keeping it for her. What I need to do is now take, this is going to be your packing 4x4. You're going to pick it up, lightly wring it out, and you need to fluff it. This is not fluffed. Fluffing is taking it and pulling it apart and making it bigger where it covers more area. Okay? That's fluffing. Now, again, we have this itty bitty wound. It's hard to get the packing in the wound. If you have that great big decubitus ulcer, you can put a whole lot more of these in there, but we have to dress what we have. So what you need to do is do your best, get it real tight and skinny, and then put it actually on top of the wound. Don't freak out if it kind of somewhat poofs out. We understand that happens. Okay, so now I've got my wound packed with 4x4s. The next thing I need to do is I need to lightly dry the skin surrounding the peri-wound area, the skin around the wound. So I'm going to take and I'm going to pat the surrounding areas. If I had more 4x4s, I would actually get rid of this and I would get me another one. And I would probably throw this one away and then get me another 2 so I'm not crossing over the sterile wound. See how I kind of work my way around? Okay, the next thing I'm going to do is I'm going to cover the wound with a clean, dry 4x4, like so. And then the next thing I'm going to do is cover it with my ABD. Now, the ABD pad, the blue goes, are these smaller ABDs? Looks like it. The blue goes to the outside. I can drop it like this, and there we go. Now my sterile part of this procedure is actually over. I can now remove my sterile gloves. Glove to glove, skin to skin, down in the trash can. Now what I need to do is tape my dressing. The checkoff sheet does not say to put on clean gloves. If this was a real situation in the hospital, I would put on a pair of clean gloves. But your actual checkoff does not. I am now going to tape my wound, and this is her tape, so I'm going to use mine. And we'll have extra tape for you guys too. I'm going to tape my wound, which my tape is a little bitty because it's been torn. You're just going to tape all the edges to make sure it's secure. I am going to put another piece of tape on the patient, on the wound right here, saying that what the day is, the date, what the time is, and my initials, basically that I did that dressing change that particular time and that day. Now, so that's all done. The next thing I want to do is get my patient back into a comfortable position. I want to cover them up. I want to put my side rail up. I want to put my bed down in low position. I want to check on them, make sure that they're okay. Is there anything I can get for you? And then I'm going to clean up my area. So, yes?
All the stuff that you don't want us to use or suggest that we don't use, what do we do with it? Do you want us
I
to
would put it somewhere else. I wouldn't put it in the kit. So what I suggest, which I'll do at the very end. So now I've got my patient taken care of. Before I leave the room, of course I'm going to clean up my stuff, throw it all away. So actually, and I have to throw away my bottle now because I contaminated that, right? So we throw that away and clean everything up. And then I'm going to wash my hands before I leave the room. And then I'm going to go document. What I'm going to document is what I did. Today I did a wet to dry dressing change on my patient. I removed when you remove the dressing, you want to describe what you saw. Maybe I saw a scant amount of serosanguinous drainage on the dressing. There was no odor noted. I did a wet to dry dressing. I would say that I took saline soaked 4x4s, packed into the wound, and then covered with a dry 4x4 ABD pad. You need to describe the wound. My wound was well approximated with a little bit of redness noted, no purulent drainage, no odor. And that also, what's really important, I always like to say that the dressing was performed using sterile technique. Obviously, we all know we're supposed to, but I always like to put that in my charting. And then how did the patient tolerate the procedure? You can say that the patient complained of no pain, patient resting comfortably, and leave it like that. But it's very, very important how your patient actually tolerated the procedure as well. Okay? And what I would do with your kits, so we talked about all the extra stuff that we have. What I would leave in my kit is, I was like, where's all the other stuff that's on the patient? And this is already pre-fluffed for you. Okay. And then you have the tape. You guys even don't this tape does not last long, so to be honest, it's going to run out real fast. That is all I would leave in there. I would take this out, and this out, and I would keep it because you bought it, but you don't need it. Why keep something in here to increase your chances of something else being there that can potentially trip you up? That is all you need. And we will give you extra 4x4s so that you have enough to do what you need to do.
And you guys, if you practice at home and you don't have you want to save your 4x4s for your checkoff, you can take paper towels and cut them in squares, okay, and use them. You've got to be creative in this class because you need to practice. You know, you can make anything a sterile saline bottle. I mean, all you do is just, you know, y'all gone back to kindergarten, you've got to use your